Family comes together for a sizzling hot plate and mocktails. The moments when friends order online for an at-home movie night. The moments when a child embraces their mom for the first time in years. Join us at Allings or order on DoorDash and make your moment. Halal menu available. Visit allingschinese.com.
Welcome to India House Houston. India House is a non-profit organization that serves the community by bringing resources, education, and services to Houstonians like health and fitness programs, language classes, charity clinic, and various events. Help the community now. Sponsor a program or volunteer for free food distribution at India House. Host your next indoor or outdoor events at India House facility, parties, weddings, or corporate events. Located centrally at 8888 West Belford, Houston. For details, call 713-929-1900 or visit indiahouseinc.org. Follow India House Houston on Facebook, Instagram, and Twitter.
Dr. Namrata Sharma Goyal at Kidney Health Center has over 15 years expertise in blood pressure control, kidney stone and kidney transplant management, hemo and peritoneal dialysis, specializing in chronic kidney disease from diabetes, high blood pressure, and autoimmune diseases. They promote the use of advanced technology in their business practice and treat their patients with a customized approach. All insurances, Medicare and Medicaid accepted. They have 3 convenient locations for you in Sugar Land, Medical Center, and West Houston area. For Dr. Namrata Sharma Goyal, board certified in nephrology, visit their website at bozenhealth.com or call 713-520-6875 for appointments. That's 713-520-6875.
गौरी सिद्धि विनायक टेम्पल ऑफ ह्यूस्टन आप सबको आमंत्रित करता है। हिंदू वेडिंग सेरेमनी हो या एंगेजमेंट, सत्यनारायण पूजा हो या गायत्री हवन, बेबी शावर पूजा हो या वास्तु शांति, लक्ष्मी पूजा हो या गणपति पूजा, या जीवन में सिर्फ पॉजिटिविटी लानी हो, आज ही कॉल करें पंडित प्रदीप पांड्या जी को 832-466-9868। गौरी सिद्धि विनायक टेम्पल लोकेटेड है 5645 हिलक्रॉफ्ट एवेन्यू स्वीट 701 पे। डिटेल्स के लिए फॉलो करें गौरी सिद्धि विनायक टेम्पल फेसबुक पे। तो आज ही कॉल करें पंडित प्रदीप पांड्या जी को 832-466-9868। जय श्री गणेश।
गणपति नमो नमः, श्री सिद्धि विनायक नमो नमः।
Namaste Radio
on 99.5 FM.
Gotta get it.
Good morning and welcome to Namaste Radio, everyone. This is Vanshika welcoming you on the second hour of our show today. Yes, it is May 21st already. And today, as I had mentioned in our second hour, we are going to go back to our mental health awareness in Asian American series. But thank you for tuning into Namaste Radio 99.5 FM. And if you want to watch us live in studio, don't wait. Go to Namaste Radio's Facebook page. Yes, it is Facebook Live on Namaste Radio's Facebook page, and we are simultaneously live on India House Houston's Facebook page. This is a special series that we are doing on mental health awareness. This is the third show of our mental health awareness series in May. And I want to thank our sponsors, India House Houston, Hawk Foundation for Mental Health, and Asian American Health Coalition, because it's them because of whom we are able to do this series. So thank you so much, India House Houston, for always supporting Namaste Radio. And this entire month is dedicated to mental health awareness. And feel free, if you have any comments, feel free to come to our Facebook page where we are live. You can always comment there. We have our guest in studio. If there's any question you have for her, feel free to ask. And you can also message on Namaste Radio's Facebook page, and we can definitely get back to you. And now coming to our guest for today, a very, very, very beautiful lady is in here today. I am actually meeting her for the first time, and I'm so honored that she agreed to come on our show and to spread the awareness on this mission of mental health awareness. So welcome to Namaste Radio, Maliha Khan. Thank you so much. A little bit about our guest. She is a licensed professional counselor. She's a wife, a mother, and a licensed therapist based in Houston. She's passionate about raising awareness of mental health in South Asian community to break the stigma and empower people to healthier lives, which not only impacts them today, but their families for generations to come. She does this through speaking engagements and content creation on her Instagram and YouTube platforms. So don't forget to follow Mental Health with Maliha on Instagram, YouTube, and Facebook. And now, welcome to Namaste Radio, Maliha. I'm so happy that you're here today.
Oh, I'm so happy to be here. Thank you so much for inviting me and bringing up this topic, which I think is so important for us to talk about.
Absolutely. And I must tell you, your topic for today was one of the topics that it took me, a little more deep thinking to actually realize the intensity of this topic because we, I think, sometimes take it for granted. But that is what the topic is today is perfectionism in the South Asian community. And I'm going to start right away by asking you, what is perfectionism?
Well, perfectionism, I think to be able to understand that, we first have to acknowledge that as humans, we all have this innate need to strive.
Right.
We all want our lives to be better in one way or another. That's something that helps us grow. It helps us create better futures for our families, for ourselves now, and in the future for our children. So it's not something that is a negative, really.
Mm-hmm.
It's something that really helps us.
Mm-hmm.
But to understand why perfectionism is impactful for us, sometimes in a negative way, it's first important to make a distinction between healthy striving and perfectionism. So healthy striving, with that, the goal is that we're wanting betterment in our life, but it's grounded really in growth. It's grounded in knowing that we're humans, we're flawed, we're going to make mistakes. With healthy striving, when we have that mindset, let's say someone gives us constructive criticism,
Mm-hmm.
we're able to see it as feedback, rather than a flaw in ourselves. So it allows us to have more growth when we keep that mindset, in our minds. It's something that really helps us create, changes for our future, for our children. With perfectionism, though, it's a little bit different.
Mm-hmm.
With that mindset, it's not really grounded in a place of growth. It's grounded in a place of scarcity. So our view of what's important or what's worthy really comes from other people's perceptions or their needs or their wants. And we almost feel like we're living for other people.
Right, right. And we do see a lot of that in our Desi community.
Mhm.
Unfortunately, the kids are also pressured to choosing a lot of things as per the parents. And I'm just giving one example, but there are so many things. As a wife, we may want to do something as per what her husband wants, or things like that. But thank you for sharing that, and feel free if you want to even talk in Urdu/Hindi. I know I didn't mention that before, but I definitely wanted to mention that. So yes, our topic for today is perfectionism in the South Asian community. Maliha just explained what perfectionism is. But I have another question to ask you. Is perfectionism a form of OCD, or what is it? Is it different? Please explain that.
Mm-hmm. So OCD, or obsessive compulsive disorder, that's actually a mental illness.
Mm-hmm.
Perfectionism is not a mental illness. It's really, a way of someone's functioning.
Mm-hmm.
Perfectionism can make people's mental illnesses worse sometimes. It can worsen their symptoms. And we see it happen with anxiety or depression, with OCD, with eating disorders.
Mm-hmm.
I have clients whose perfectionism impacts their symptoms in a negative way. It makes them worse. And then I also have clients who deny being perfectionists and they still have anxiety or depression or other mental illnesses.
I think, and my husband always makes fun of this part of me. He's like, you want things your way.
Mm-hmm.
I think I am somewhere in between over there.
Mm-hmm.
And it used to affect me more before, but I worked on it. I'm like, if by chance we have some technical glitches and things happen when you're doing a online show and stuff like that. And that would bother me the entire day if something goes wrong. Whereas I see people, they're like, okay, it's done. But I'm probably, I think my, like, they tease me. And that's like a, normal term that all of us have learned to tease people who strive to be perfectionist or whatever is, oh, you have OCD. So that's why I wanted to make sure that our audience out there understands the difference between perfectionism and OCD. Thank you for explaining that. Now, why is perfectionism so prevalent in the Desi community?
There's certain unique factors that we have in our community that contribute to this. So our community, just being Desi, we have this label of being a model minority within the U.S. So we have a set, clear set rules of expectations that are expected of us, and we are expected to be good at math. We're expected to grow up and become doctors.
Yeah.
Our B pluses in some families are considered to be Fs.
Yes.
Right?
Yes.
Yeah. And so we're coming from generations and generations of this mindset of appearing, like we have it all together. If you were to go to like a family davat or something, you will see that conversations will be about our children getting into Ivy League schools, or, buying a home in the most coveted neighborhood, or, purchasing the latest model of Mercedes, or finding the perfect match for marriage. And so that's really what our norm is. And because that's our norm, it's really hard for a lot of us to see that perfectionism or having these high expectations can sometimes be problematic. And I'm not trying to say that we shouldn't want more for our lives. That's not what I'm saying. But going back to that idea of healthy striving and why we do what we do, that's really what helps us create a healthy perspective.
Right. People are, I think, struggling these days to match up to the community. And I think that's where their health, physically or mentally, can bother them. Like, yeah, you absolutely nailed it when you said you go to parties and we have aunties talking. It's about not only but financial, it's also about marriage. Oh my God. मेरी बेटी के लिए तो इतना अच्छा रिश्ता आया है, मेरे बेटे के लिए ये आया, and then that's all the comparison, it's crazy out there.
Yeah, it's rough. And it's what our community, because it's so strongly collectivistic, we really rely on each other, which has been a positive and a strength in our community.
Right.
That factor sometimes makes it complicated because we also have this rule of ghar ki baat ghar mein.
Correct.
We don't talk about things with other people outside our home. And it creates this perspective or this mindset that everybody is doing well. And so if we are struggling in any area, we worry that we're the only ones,
right.
And there's this fear of being persecuted or being rejected by our community if they were to find out that someone in our family or ourselves was struggling.
Absolutely. Absolutely. That is very common. We keep hearing that all the time. But I'm so glad that you brought this topic up to address it so that people out there who are listening can understand it. Because again, one thing after doing all this mental health series, one thing we've always realized is people still feel talking about mental health related issues is still a taboo. They don't understand what it is, but they just say, nahi to pagal hai. Don't talk about this because wo pagal hai. But that's not what it is. And that's why every week we are trying to talk to, different counselors. These are professional to everybody listening out there. So listen to this and try to understand and change your lives accordingly. Now, we spoke about, perfectionism is so prevalent in the Desi community, but also it's a big, big, big problem. So give us more insights on that.
Right. I wanted to mention here that there's research, thankfully now, way back when there wasn't much research for our community, and slowly, thankfully, we're getting more and more details about that and being able to really see how much it impacts us. There's research conducted in the UK, and what they found was that there's higher levels of depression and anxiety in middle-aged Pakistani men and older Indian and Pakistani women when compared to white people who are their same age. And this is true regardless of someone's socioeconomic background. So it doesn't matter, if they're from an affluent family or not. We find these numbers to still hold true.
Wow.
Yeah. It's not a white people problem,
right.
as sometimes we might think that it is. It's something that we're not immune to, even if we think that we might be.
So much pressure and stress at that age.
And it's true for young people as well. There's research that shows that unfortunately young South Asian women have higher rates of suicide compared to the rest of the general population in the U.S.
Oh, wow.
Yeah.
That is really shocking to know.
Mm-hmm.
But I'm actually at loss of words after hearing that, because I always thought that desis yet have not reached that level of suicide and stuff like this. But I think just this week there was a big family incident that happened where the husband shot the wife, the mother-in-law, the kids, and himself. But we are hearing this more and more. Now, what prevents people from reaching out for help? You said that we still don't want to reach out, right? So what is preventing them?
Right. I think there's a lot of stigma, about mental health treatment. Unfortunately, kind of what you mentioned earlier, that people have this perception that, if they were to see someone like me, that they're pagal or they're crazy, which is not really true, but that's what we believe in our community, unfortunately. If I go to, a party or something and someone asks me what I do and I tell them I'm a therapist, I'm a mental health counselor, they say, oh, so that means you work with crazy people. And I say, no, I work with people just like you and me, because we really don't need to have a mental illness to seek out help. But that's the perception that, is true in our community, unfortunately. And then because of that, people don't reach out for help, or if they do, they feel absolutely terrible about it, or they feel like it's something to hide.
Yeah.
And as I was talking about suicides in our community, just last year, within a matter of a few months, we had many deaths by suicide, deaths of mothers. And one of these mothers, her name was Nima Bhakta from San Diego, California. She was 31 years old, and just 7 months after giving birth to her baby boy, Keshav, she took her life, unfortunately.
Oh my God.
She was struggling with postpartum depression, and although she was having a hard time, at her 6-week checkup with her doctor, she told her doctor that she was completely fine. And what we know from her family's accounts, and there's actually an unsent draft that was found on her phone, she had a really difficult time with the fact that she needed support, that she needed help. She was wondering, why is it that she's struggling when her mom and her sister did not have the same struggles? So she had, high expectations for herself, and she felt like she was failing those expectations. And she also felt like she was failing society's expectations.
I see. So is it at that point that a spouse, at that in her instant, like it's the husband, a spouse is expected to rise and take charge and help support? Could have been a negligence from the spouse side for?
Well, in this specific case, her family was very supportive.
I
Both
see.
her own family and her in-laws. They encouraged her to attend therapy and also to take medication. She herself struggled with that part.
I see.
So she was advised to take medication, but unfortunately, she felt like, that going back to that same thing, why is it that I need medicine? My mom, my sister did not need that.
Right.
But sometimes people do need extra support.
Yeah.
Unfortunately, she felt like she was falling short. And it was, in her mind, that was not something that she was ready for. And that over time, when it's not really looked after and it's not treated, can become very dangerous. And it ended up with her taking her own life.
That's very unfortunate. It's important. When I do these shows, I always request people that anytime they feel, even you just feel low, I think first thing is to talk to people about it. Sometimes you have family who's supportive, sometimes you don't have people who are supportive. And living in the US, it's pretty lonely if you don't have family around. So it's good to talk and reach out. And like Maliha said, that we still have people who think it's not okay to reach out to counselors at this point, but reach out, take help. It is important. My next question to you before we get into our ad break is that how to challenge perfectionism as an individual, like or as a community. How can you do that?
So I think that's a journey. It's not something that happens overnight for people. And for many of us, when we embark on that journey, we'll find that we have to keep challenging perfectionism in our lives just because of how prevalent it is for us.
Right.
It just runs so deep for us, and it shows up in different aspects of our lives. So it's something that requires continuous work. But there's some practical tips that we can implement in our daily life to help combat it. The very first thing really is to know that we're engaging in it. Like I said earlier, a lot of us find that this way of operating to be such a normal, quote unquote, normal thing that we might not even see it as an issue. Right. So first, we have to really go back to the idea of healthy striving. There's nothing wrong with wanting more for your life or wanting, having high achievement. There's nothing wrong with that.
Right.
It's about how we approach that, so really keeping in mind the difference between healthy striving and perfectionism so that when you engage in it, you're able to catch it. That's the first step.
Mm-hmm.
The second thing that people can try to do is, give themselves more grace, allow ourselves to make mistakes. We're human, we're flawed, we're going to have setbacks, we're going to have shortcomings, and keeping that in mind can be very helpful. I'll encourage my clients to ask themselves this question. I say, ask yourself, what would I tell my friend in this scenario? If I had a best friend, what would I advise to them if they were in my situation? And a lot of times people find that they're much kinder to their friends or their loved ones than they are to themselves. So asking that question can really create a shift in our mindset.
That's wonderful. And with that, I want to also ask you that in your, when you're seeing patients in the patient pool, do you see a lot more Desi people, or are you seeing non-Desi people?
I see a mix of Desi people and people of different backgrounds. Really,
I see. And do you see an increase in the Desi population coming to you?
Yes, I do. I do, which I think is a good thing. Because a lot of times people, they don't reach out and when they need to, So I think it's a good thing that people are reaching out. There's been a shift, thankfully, and I think it's because of social media in a lot of ways, because people are on there talking about mental illness, and especially the young Desi community and the young people in our community are really talking about how, their generational ways of functioning have impacted their personal life and what they can do differently.
I see. One question I want to ask you is, other than our topic, is how did you get into, being a counselor? Like,
that's a good one.
what made you say that, okay, I want to do this?
So I was actually, I came across this field in my high school psychology class. That was the very first time. And I've always been a very shy student. I was not someone who would raise their hand. I was very self-conscious. I am a recovering perfectionist. So at that time, I did not do that. But with psychology, I found myself to be very intrigued. I would raise my hand, ask questions. I wanted to sit at the front of the class. It was something that I was very much into.
Right.
And that's kind of where my interest began. And I did go through my college years, and I had the expectation of going to med school and, okay, maybe not med school, then maybe dental school. Okay, if not that, maybe PA. So there was a pressure to be somewhere in the healthcare field.
Right.
I just knew myself and what I was interested in. So I did have the pressure from my family to pursue the medical field. At the same time, I tried to keep in mind what was important to me. So I was applying to those programs, but at the same time, I was applying to programs for, getting a master's in the mental health field. And that's, kind of what started this process. I got in and I was like, all right, well, this is where I'm going. I told my parents, it was an adjustment. And till this day, they say certain things, and also they're very supportive, thankfully. They see how passionate I am about this. And I think that's what helped them make that shift of, okay, this is what she's doing. And, we have to accept this, and, we're proud of her. And they tell me that, which is really wonderful. So thankfully I've had that experience, that's kind of where it began for me.
That's good. I'm happy to hear that. And thank you so much for sharing that. I know I just popped in that question.
Yeah.
But it's good for everybody to know, how you got into this field. On that note, to everybody watching us, I am going to get into a quick ad break. We will be back very soon, but we are in conversation with Maliha Khan. She's a licensed professional counselor, and we are talking about the topic of perfectionism in South Asian community. Stay tuned. This is Vanshika Vipin on Namaste Radio.
स्वागत है आपका सुनते रहिए नमस्ते रेडियो
Hi, I'm Hossein Hadi, candidate for Justice of the Peace in Precinct 3 of Fort Bend County, and I'm asking for your vote. Thanks to your support, we made it to the runoff elections. Early voting starts on Monday, May 16th until Friday, May 20th. There are no weekend voting dates, and Election Day is Tuesday, May 24th. As the most qualified and only born and raised candidate in this community, I'm asking you to come back out once again and show your support by casting your vote. Thank you.
For details, visit hadiforjudge.com.
Welcome to India House Houston. India House is a non-profit organization that serves the community by bringing resources, education, and services to Houstonians like health and fitness programs, language classes, charity clinic, and various events. Help the community now. Sponsor a program or volunteer for free food distribution at India House. Host your next indoor or outdoor events at India House facility, parties, weddings, or corporate events. Located centrally at 8888 West Belford, Houston. For details, call 713-929-1900 or visit indiahouseinc.org. Follow India House Houston on Facebook, Instagram, and Twitter.
At Allings, we are all about the moments. The moments when family comes together for a sizzling hot plate and mocktails. The moments when friends order online for an at-home movie night. The moments when a child embraces their mom for the first time in years.
Oh my God! Oh, come on, me.
Join us at Allings or order on DoorDash and make your moment. Halal menu available. Visit allingschinese.com.
Navigating the complex world of health insurance can be frustrating. So why wait? Call an expert today. We present to you Simple Choice Insurance Brokerage. Call them today and get a health plan that fits the way you and your family lives.
Simple Choice offers affordable health insurance for you and for the people you love. Simple Choice will make this easy for you. They will assist you through the process of selection and utilization of your benefits. Simple Choice provides excellent service.
Want to learn more about individual plans, Medicare, dental, vision? Call Simple Choice today. Get a head start on your 2022 health insurance.
Visit www.simplechoiceib.com/namaste or call 832-626-7791. That's 832-626-7791. Follow Simple Choice Insurance Brokerage on Facebook and Instagram.
Namaste Radio.
Coming in.
Live every Saturday at 10 a.m. on 99.5 FM, 24/7 on NamasteRadioHouston.com.
Yeah.
जी हाँ नमस्ते रेडियो
That's right. This is Namaste Radio, and this is Vanshika. You are tuned in to Namaste Radio 99.5 FM, and we are live on Namaste Radio's Facebook page. In conversation with Maliha Khan, talking about perfectionism in the South Asian community. She shared a lot of stuff with us, but we are going to go back to asking her a few more things about what prevents people from reaching out for help. And Maliha, please give us more insights on that.
So I think there's many things really that again are unique for us. Like I said, before that, there's this idea of ghar ki baat ghar mein, and there's also another rule of smiling through our pain. That the more we endure, the stronger that we are, and especially as women, we're told that if you're quiet, if you don't speak up, if you're submissive, then those are the women that we really should look up to,
Right.
And that kind of creates a difficulty for then people to say, okay, I'm going to do something different.
Yeah.
But smiling through pain is not heroism. it takes a lot of bravery, actually, a lot of courage for people to speak up, especially in our community,
Right.
because that's not the norm for us, so going against that is very difficult to do. But that's one of the reasons why. And, sometimes, let's say someone does speak up. People say then, other people have it worse than you.
Right.
Like, shukar karo, be grateful, or, jab hamare zamane mein to aise hota tha, like we had it much worse back in our day. So, after hearing those kind of statements, and it might be well intentioned, I don't think that our elders or anybody is saying this because they're not trying to be supportive. They're saying it because that's how they know to show support.
Right.
But unfortunately, hearing that advice over and over again can make people believe that they shouldn't really speak up or say anything.
And I think with that brings me to this example of which I hear pretty often from our Desi women, where you said that yes, it could be your mother, it could be your mother-in-law, it could be your sister-in-law, your sister, a woman telling another woman, especially when she's complaining about her husband and maybe he's abusive, not at what, I don't know at what extent, but there's so many times the domination of men in our society, and it's still there. So many people don't want to accept it, but it's still there. So a lot of times we hear that from our mothers or mother-in-law, or, like I said, and you rightly said that they don't mean ill, or but उन्होंने सीखा ही वो है, तो उनके कहने का तरीका ही वो होता है. लेकिन it's not the right thing for someone कि नहीं, अगर वो बदतमीजी कर रहा है तो आप कोई बात नहीं, लड़के तो ऐसे ही होते हैं, ठीक है, ठीक हो जाएगा, so these kind of things I think अब आगे जाके ये चीजें चेंज होनी चाहिए.
Right.
And I'm so glad that you brought this up. Anything else you want to add to that point, Maliha?
I mean, no, just you saying that, theek ho jayega. There's this idea that, just get married, everything's going to be okay.
Yeah.
And like, shaadi ke baad sab theek ho jate hain, which is not true.
Uske baad bachcho ke baad.
Right. It just keeps going, like, bachcho ke bachche ke baad, right?
Yeah.
Like, it keeps going, but it's not true because, people continue to struggle with what they struggle with because of a reason.
Yeah.
And until they get the right help, or, until they have certain consequences, they might not want to make a change in the way that they're operating.
Right.
So if we tell our kids that, shaadi ke baad theek ho jayenge, it's not always true, and we sign our children up for something that can be very dangerous.
Absolutely. Now, what kind of mental illness can perfectionism lead to?
That's a great question. I think it's, like I said before, it's mental illness is separate than perfectionism. Perfectionism, is about a person's functioning. Mental illness, what we know from research is that it has many different causes. So it can have genetic causes. It can be because of environmental causes, right? So there's different things that can impact someone's outcome of having a mental illness. But perfectionism, we know, like I said, makes things, complicated, or can actually worsen symptoms for people at times. Let's say, for example, someone has social anxiety and they also struggle with perfectionism. What they might find is that it's much harder for them to be present in a social setting and be able to speak up because they're more likely to be self-aware or self-conscious.
Right.
And so they might completely remove themselves from social settings. They might not be able to sit through that. They may avoid parties, or they may avoid going outside. So it's something that can definitely be impactful in a negative way for people who are going through a mental illness. And then we also know that perfectionism contributes to worsening suicidal thoughts. Let's say someone's struggling with that. With that mindset, though, it leaves no room for error for us. So any kind of shortcoming, any kind of setback can be very triggering, very upsetting for the person who's thinking about those things, and sometimes, unfortunately, can make them act on those thoughts.
Do we see a lot of this particular issue in like successful businessmen, or like high achievers who are already there in the society, but they have that constant pressure of keeping that up? I think I was reading and actually seeing this documentary on Elon Musk, I must mention, and he is kind of a perfectionist.
Type A, as they say. Yes, yeah.
So, but I don't know, I don't remember the exact title, but it said the kind of like the repercussions of being so successful in life. So do you have you seen that? Like, have you heard about that? Like,
yeah, and because it can happen so naturally. We might feel pushed to do more, be more, say more, have more. It can definitely show up in high achieving people or jobs that require that. And again, there's nothing wrong with wanting more and doing more. We make a better world through that, but it's about how we approach it that really counts.
Right. So basically, it's like all of this does come with, these side effects, but it's okay. Like, even the thing was, even if Tesla fails, even now it's okay. We don't want that, but
Well, yes, we don't want that, but yes, but I see what you're saying. Yes.
Now coming to our next question. So, what can someone do if they don't have support in their families? And that's I think that's a very, very, very important question that people would want to know.
Yes. I think, it can be very hard for someone in that situation, and they might feel even more isolated and not know where to look. But it's important to see if you can create a support group outside of your immediate circle. Thankfully, because now we have the internet, we have social media, it's a little bit easier for us to find different organizations around us, or even online support groups through Facebook that we can reach out to find some kind of support to challenge this way of operating. Of course, we can't open up to every single person.
Right.
This conversation is not about, okay, well, let's go to the opposite end and just share everything that's going on within us. There's a time and place and the right person to be able to open up to. So it's important to keep in mind that as we're trying to find our tribe, to look for people who value the same things that you would do in terms of, valuing, challenging this kind of way of being, and also people who are sincere towards you, people who are genuine. When you've built that connection and that safety in the relationship, then it's definitely helpful to open up to them about what you might be struggling with.
I see. And when do you recommend going to a counselor? Is it like first go to the support group and then go to a counselor, or doesn't matter? You can go to anyone anytime. Like,
well, people come to see us, sometimes when earlier on, and then sometimes some people wait much later to go seek help. I advise people that if you find any challenge, it doesn't have to be perfectionism, but if you find yourself to be more anxious, find yourself to have lower mood, be more depressed, if you feel that is impacting, your ability to function, that's definitely a sign that you should seek support.
okay.
So it's better to not wait too long, because we know that the earlier someone seeks help, the better they're able to cope over the long run. The later someone might seek help, let's say it's been years, it started when they were teen, but they didn't actually start seeing someone until they were 20 or 30 years old. For them, their outcome is a lot different. The earlier we have intervention, the earlier we have treatment, the better it is for people.
Absolutely. And now, our next question: perfectionism is the most paralyzing form of self-abuse. And what do you think about this quote?
I think the quote is really talking about the degree to which perfectionism can harm us. It's something that impacts our view of ourselves, of other people, of our world. And, because there's no room for error, like I said, it can really create this internal feeling of shame, this feeling of, there's no point in trying sometimes. And there's a researcher, a very famous researcher and author, her name is Brené Brown, and she talks about how perfectionism can lead to shame. And she says to understand this, first we have to talk about guilt. Guilt and shame, what the difference is between the two. So guilt is about what we did. Shame is about who we are. Guilt is, I did something bad. Shame is, I am bad myself. I, to my core, am a flawed human being. I am bad. I'm not worthy. I don't deserve anything. Guilt helps motivate us. It empowers us. It holds us accountable. It helps us make positive changes in our life. Shame, on the other hand, it corrodes the very part of us that would lead us to be motivated. So for a lot of people who experience that shame because of their perfectionism, they might, feel paralyzed. They might feel like there's no point in me trying to do anything different, because if it's not perfect, it doesn't really matter. And that's what's really self-destructive.
Wow, those are some great points, and I totally agree. And sometimes I think a lot of us try to mix guilt and shame, and I'm happy you lined them perfectly here. Now, reaching out to you, how can people do that? And if you can share some more resources out there that you think people can reach out to.
Yeah. So if someone wants to reach out to me or speak to me, I work at the Menninger Clinic. So they can reach out directly to the Menninger Clinic and request to see me. The phone number is 713-275-5400.
One more time.
Yes, 713-275-5400. Okay. And people can, again, when they call, they can specifically ask to speak with me. Other resources that they might be able to find are within the community. There's Anisa, there's also Dea. Those are wonderful resources specifically for our community that could be helpful for them to reach out to. And then I wanted to mention some books if some people are into reading more about these topics, and especially I think just keeping in mind how our the way that we're raised and the approaches or the views that we have in our community, how they can be helpful, and then somehow, sometimes other parts of it may not be so helpful. Right. There's again, Brené Brown, the author, she wrote this book called The Gifts of Imperfection. And it really talks about this idea of perfectionism and how we can overcome it. And, I found actually with my clients who are Desi, when they read this book, they are, they're just blown away because it's so relatable, especially for mothers. They find it to be very helpful. I actually had a client who said, I felt like when I was reading it, I was just stuck on the first 5 pages for a good week because I kept going back thinking about, wow, I do this, and I see how it stands in my way. So it really, it's a resource for us to be able to evaluate, be curious about ourselves, right. And evaluate how we're doing things.
And what's the name of the book again?
The Gifts of Imperfection.
The Gifts of Imperfection.
Yes.
I think I need to look it up and read myself. But is there any other resource that you would like to share, or?
There's another one that I wanted to mention. It's called It Didn't Start With You. The book, the author, his name is Mark Wolin. Wolin, I hope I'm pronouncing that correctly. But It Didn't Start With You, and it talks about how generational dynamics can impact us. So, even about how when a mother is pregnant with her child, how what she might be experiencing in her life can impact the baby. Stress that she might be experiencing, how that can impact her baby and grandkids in the future. So again, I know that our community, it's so strong, so collectivistic, and we really care about each other. So keeping that in mind, I think it's important to really look at, how we all are so connected and how the decisions that we make can impact our future.
And I'm going to request Maliha to actually send me a few links of all this. And what I'll do is I will go back to this Facebook Live video and pin it up, and also pin her information. But also don't forget to follow her on Facebook, Instagram, and YouTube. And it's Mental Health with Maliha. And I'm going to pin that as well. So that way, when they come back, they can always, directly go there and look at all these things. But we also want to thank Hope Clinic for supporting the mental health series on Namaste Radio. And you can reach their behavior department at 713-773-0803. And also Asian American Health Coalition. They're doing a wonderful, wonderful thing for, reaching out to our Desi community about mental health. So, and also Okay to Say, it is a Texas-based public awareness campaign, and follow them on Facebook. It's just Okay to Say, the easiest thing. And of course, I can't end the show without thanking India House Houston. They are the main sponsor of this series, and India House Houston does a lot of work for our community, our Desi community, but everyone is welcome. And the easiest way is follow India House Houston on Facebook and Instagram and Twitter, and visit their website for different various free programs. It could be BollyX, yoga, art classes, soccer classes. telehealth consultation, family law consultation, immigration, and relationship coaching consultation for free with Deepti Patel. And the India House website is www.indiahouseinc.org. And you can call them at 713-929-1900. A lot of things that we shared today about mental health, perfectionism in the South Asian community, a very, very, very important topic. अगर आप लोग अभी हमें ज्वाइन कर रहे हैं तो you can always go back on Namaste Radio's Facebook page and listen to this video. You can watch this video. You can we'll also have a podcast released on Monday, so you can listen to that on Namaste Radio's Facebook, Instagram. And yes, do reach out. Give us your feedback. If whatever Maliha has shared today, if you feel you are able to connect to it, you think you need some help, don't be shy. Please reach out. आप हमें नमस्ते रेडियो के फेसबुक पेज पे मैसेज कर सकते हैं या आप मलिहा को डायरेक्टली भी मैसेज कर सकते हैं at mental health with Maliha on any platform. I'm sure a lot of y'all are already on Facebook, so don't shy away. At least follow. She has these amazing, thought-provoking, that you share on your social media messages that you have. So I love it. I am a fan of your page and I follow it, I think, for a long time now. So thank you for everything. But before now we let you go, is there anything else you want to add to our topic? Give out, a positive message to people out there. Please go ahead.
Yeah. There's a saying that pain travels through generations in a family until someone is ready to feel it. So we might think that, with the struggles that I went through will end with me, but that's not really true, because the impact of that really carries through us and onto our loved ones. So when we decide, when we choose healing, we're actually changing our future. Because
Absolutely.
with creating healthier dynamics, when we decide that this is what I want for my life, it not only impacts us today, it impacts our loved ones who are around us, impacts our children and their children, and so on. So I wanted to encourage our audience to, don't underestimate the power of healing generational cycles and patterns. It's never really too late to make a positive change and choose health for your life.
Absolutely. That's such a beautiful thought. And a lot of times we don't realize it, but it is very important. It's important for, I think it's just important for me to heal so that everything in my future, my kids, everybody will be healed. Because I think since we have 5 more minutes, I think if I am struggling through something, everything that I do for my family, my husband, my parents, my kids, I think it's impacting everything, right? And एक बच्चा छोटा है, अगर मैं कुछ स्ट्रगल कर रही हूँ उसे नहीं समझ में आएगा, लेकिन he will probably have a lot of effect on him or her as well, right?
Right.
What do you have to say about that?
Right. And that's such a great point that you brought up, because for mothers, and fathers as well, I'm not saying that one is more important than the other. Both parents are very important to a family. But I remember actually someone had mentioned this to me, that their mother was actually going through postpartum depression, and after having, their sibling. So this person was saying that, I was very confused about why my mom changed her behavior towards me. I felt like there was something that I was doing wrong. I felt like she was crying and spending her days, being by herself, isolating because she didn't want to be around me. When that's really not what was true. What was true is that she was going through her own stuff, but because she didn't either have the space or maybe even know that she was having a hard time, or why she was crying so much or struggling, her kids internalized that as something that was wrong within them. So really,
That's so sad.
It is sad.
Yeah.
It is sad, and that happens quite often. We don't share with our kids because we don't want to make them sad. But there's healthy ways to have these conversations. It doesn't have to be very overwhelming or overpowering. And there's, of course, not kids don't need to know everything. There's age-based healthy limits of how much we might share with them, but just being able to tell them that, hey, this is, I'm not crying because of you.
Right.
I'm just having a hard day today,
Yeah.
or I'm just having a hard day because of this other thing. It helps kids understand that they're not the ones who are to blame, because as children, just the way our brains are developmentally, children usually see life from their own perspective. So, even if something else is going on, they internalize as, oh, that person doesn't like me, or it's because I did something wrong.
Mm-hmm. And that's a very important point. And also at this point, I want to tell everybody out there that even if you're a desi man, and we have one very supportive husband right here, I must tell, thank him. He's been Maliha's husband's here, and I'm sorry. Can you please introduce his name, please? Sorry.
Yes, it's Hassan.
Thank you,
Yes.
Hassan. He's been such a supportive husband. I can see throughout this show. He's been taking pictures and everything. So thank you so much for visiting our studio. But at the same time, what I was going to say is, a lot of times in our Desi community, men don't talk, men don't share, and वो कहते हैं ना घुट-घुट के अंदर मरते हैं फिर. So we want to request this, because every time I talk about mental health, I don't only want to focus on the women or the children, but also our Desi men, because like you just said, husband wife together, they're both important for a child. Same way, if the man is not feeling mentally proper well, it can affect everything around. So if you're a desi man out there, if you think you have anything you want to talk about, please reach out. I think men don't do that as much as ladies do. So please reach out. But thank you. On this note, I think we'll wrap up our show today. But thank you again, Maliha. It has been a pleasure talking to you. You shared some really great points. And every time, I always say this, every time I talk to a guest on this show, it's a big enlightenment for me. It's an uplifting show for me. And I try to, apply whatever I can in my life. And there are a few points. The first thing, I'm going to go read that book for sure. But anything else you want to add at the end?
I just wanted to say thank you so much for having me on the show and talking about these topics. I think it's so valuable to be able to share this information with our community, because with awareness, that's where change can begin. If we don't know what else to do. So we keep doing the same thing over and over again. So it's really important, the work that you're doing, spreading awareness through your show.
Thank you.
It's incredible.
Thank you so much. And again, thank you to you for taking our time being here. Thank you, Hassan, for supporting her coming here. And this is not the last time that I will be speaking with Maliha on Namaste Radio. So stay tuned. I'm sure we'll have a lot more to talk in future, because mental health, we have a lot to discuss. But thank you to everyone who joined us on 99.5 FM. And a special thank you to everybody who joined us on our Facebook Live. You guys know you're my favorites. Don't forget, follow Namaste Radio on Facebook and Instagram. And you can listen to non-stop Bollywood music throughout the week, 24/7 on namasteradiohouston.com. And any Alexa products in your house, just say, hey, Alexa, play Namaste Radio Live. So thank you. I will be back next Saturday right here at 10 a.m. Thank you so much. Thank you.